The following are the scripted questions that my audience has asked in relations to my presentation on hospice care. Audience, do you have a question?
Yes. If hospice is such a great thing, why aren't more physicians encouraging patients to use it?
That's an important question, and it's important to demystify death and dignify the dying process. Many physicians are uncomfortable with the subject of discussing death. A recent survey shows that only 6 out of 126 medical schools in the U.S. have a separate required course on end of life care. This information I got from Morris, and it was dated 2001. However, there have been more recent studies which say that those statistics are still relatively true. Question number 2.
Who makes the decision that hospice is an appropriate choice?
The decision to involve hospice should be made by both the patient and the family, involving also the physician. The physician has to be supportive of this decision, and he needs to write an order for hospice services. The hospice team is physician driven. It is composed of many disciplines. Once the medical diagnosis is made that the person has a condition that is life limiting, options should be offered to the patient and family. Marilyn Webb, in her book The Good Death, devotes a chapter to the subject of who decides and entitles that chapter, Who Decides Law and Politics at the Edges of Life. The decision for hospice care is made after discussion with the patient and the family that comfort care is the best option for the patient. The hospice team is composed of doctors, nurses, social workers, chaplains, home health aides, and therapists. And together, these persons meet to devise a systematic plan of care until the death occurs. Um, the setup for hospice care is documented in the works of Payne in the year 2009. It gives a full reading on exactly how the team is to be composed as is mandated by the Centers for Medicaid and Medicare. Is there one more question?
I believe there is. Um, are you proposing that doctors are responsible for the state of healthcare affairs in the United States?
Actually, scientific advances force doctors to keep up with the latest technology. Today's consumer expects the best that modern medicine has to offer. The cost of healthcare is impacted by inflation and patient demands for more advanced technology. We have an aging population with multiple health problems and an increasingly high cost of medications to meet those healthcare needs. Physicians should look at comparative costs of having patients in the hospital with modern technology or versus in the home where they can be comfortable and have excellent end of life care. Thank you very much, audience, for those wonderful questions.
Why is healthcare so expensive?